And speaking of people doing great things, Dr. Paul Thomas, Direct Primary Care from Southwest Detroit. He has a business, Plum Health, again, Plum Health Direct Primary Care. He's doing some great things. He's kind of shaking up the model a little bit in the Motor City. He's been doing some great things. So I'm going to get to this conversation with him. Paul, good morning. Thanks for joining me.
Thank you so much for having me on again. It's great to be here.
Glad to have you back. There's a reason I want you to come back. And first of all, happy Thanksgiving and happy holiday season to you.
Thank you so much, and to you as well.
Thank you. I've been tracking you, and you are really doing some great things. One, I saw recently where you were a speaker at TEDx in Midtown Detroit at the Charles H. Wright Museum of African American History. Number one, we'll come back to that. And number two, your business is really doing well, and you've grown since the last time you've been back on Small Talk. So, first of all, congratulations to you.
Thank you.
Absolutely.
Thank you. Yeah, both of those things are awesome.
Good. So briefly, for our listeners across the country, tell them about direct primary care and the concept.
Yeah, so direct primary care is this concept where I'm your family medicine doctor, and I take care of you directly, and we don't use or bill insurance. And there are direct primary care clinics across the country, about 717 of them. If you want to see where they're at, you can go to the Direct Primary Care Mapper. Just Google that, and you'll find plenty of doctors who are doing it like I am in Detroit. I practice in Southwest Detroit, and people pay a membership at my clinic of $10 a month for kids, and it starts at $49 a month for adults.
The reason I'm having this conversation with you is the timing is apropos. Certainly, there's a lot of discussion about health insurance and people enrolling for 2018, and I think you have a very unique practice. The other thing that I want to point out, you can also read about Paul. I did a story of him in Cranes Detroit. You can just type in his name, Dr. Paul Thomas, in Cranes Detroit, and his articles should pop up, the one that I did on him. So let's back up a little bit. We'll come back to the practice a little bit later. You recently had a great talk a couple weeks ago, TEDxDetroit. Talk to us about that.
Yeah, TEDxDetroit, it was November 9th. TEDxDetroit is a huge event, and it was really an honor to be selected for that. You know, I went to the event last year at the Fox Theater, was an audience member. I was really inspired by it, and so I followed it, and I applied when the application opened. And I have an idea worth sharing, that healthcare should be affordable and accessible for everyone. And that was my main thesis on that night. And I told some stories about growing up and wanting to be a doctor and wanting to give back and wanting to serve. And also told some stories about how people have a hard time with the current system and how it doesn't accommodate us, how it doesn't listen to us, and how it doesn't value those human relationships that I care about. So I tried to weave some stories in and include some facts and figures and talk about how we're making healthcare affordable for folks in Detroit.
And it was packed, wasn't it?
Yeah, it was a packed house, and they actually did 2 sessions because Charles H. Wright, they have a smaller venue than, say, the Fox, so they did it in 2 waves, and it was great doing it twice on stage.
So when you blew up social media, and what I mean by that, people are literally taking quotes that you were saying, and they were tweeting you out. I know we follow each other, so that's how I was able to track you in terms of what you were saying. So you kind of alluded to a couple of the key messages. Let's peel the onion back just a tad and kind of delve into a couple of those key issues or key messages. One more time, what were the 2 or 3 key messages you wanted to communicate?
Yeah, so one of the things that I communicated was that your typical family medicine doctor has 2,400 patients in their panel, and they typically see 1% of their panel each day. So that becomes 24 patients each day. In my model, I cap my practice at 500 patients total. Currently, I'm at 210, and so I see about 2 to 4 patients a day, depending on how busy. Sometimes I don't have anybody to see, so I'll work on my social media stuff. But the point I made, and I had a stage prop. I had a pit of sand with a cup, and I had one of the stage managers pour the sand through my hands, right? And I made the analogy that taking care of folks being a primary care doctor is like trying to catch sand. And the faster those grains of sand go, the more they slip through our fingers as primary care doctors. And those grains of sand are your child's sore throat, or your brother's chest pain, or your grandfather's overgrown toenails. And your doctor a lot of times just doesn't have time to fully address everything.
So, is your practice, as you're defining it now, is this type of practice, direct primary care, catching on in Detroit, do you think?
Yes, I think we're getting a really good amount of traction in the Detroit market, and it's thanks to you. The piece you put out in Cranes was terrific. We also had a really nice piece on WDIV,
I saw that.
which was awesome for us and drove a lot of traffic our way. And then just being out in the community, engaging with folks at Open Streets Detroit or being a part of TEDxDetroit helps people to understand. And I think 90% of what I do is teach people about the model and the unique aspects of it.
When did you launch your practice, your current practice?
1 year ago.
1 year ago.
So November 1st, I did my first house call. So it was a house call practice initially, and then in January, I leased out my office.
And the reason I asked the question, I remember, I think the first time I met with you face to face, I was actually, Joe Biden was in town.
Yep.
And I remember you pulled me over. I was actually down at the blog about Joe Biden coming to Detroit. And you pulled me over, and I was a little bit distracted. I don't know if you remember this. And I came into your office, and I said, "This is where you practice?" He said, "Yes." and so Paul starts talking to me, starts saying, "Hey, Mark, I appreciate everything you're doing around Detroit Dope and this and that." And I'm distracted. He casually had a conversation with me, and the more that he talked, I kind of kept one ear on what you were saying, and that's kind of how I kind of connected with him the first time, right? And then over the last 12 months, you came on Small Talk, I think back in March of this year,
Yeah.
and we talked about the uniqueness of your practice. And then as I continue to track you, we had a conversation recently, and you said the number of patients have grown, obviously, over the last 12 months. So what have you grown from what to what now?
Yeah, I obviously started at 0 November 1st, and then when I got the office, I started enrolling about 20 new members a month. I think when I was on with you in March, it was probably around 50 or 70, and now we're at 210. So
210. And you're going to cap it at 500.
Mm-hmm.
So I guess the benefit for the patient is they get more one-on-one time with you.
Yeah, typically an hour during your first appointment, and then if you need an hour the next time, great. If you just need to pick up a medication, it could be 2 minutes. It's up to you.
So what is wrong, Paul? And we're talking to Dr. Paul Thomas. He's a doctor, obviously. He's has a direct primary care in Southwest Detroit called Plum Health. He's doing some great things here in Detroit. He really has a unique approach. He makes house calls. He's actively engaged in Southwest Detroit. You see pictures of him. He always has his stethoscope around his neck with his white coat, if you will. And so people certainly know you. But what is wrong with our current, not a political discussion here,
Mm-hmm.
what is wrong with our current healthcare system?
For me, it inflates the cost of health care. So when you buy health care through an insurance provider, it inflates the price and it makes it unaffordable for most people. And people are scared to go to the doctor because their deductibles are now $5,000-$7,000 for the year. So they end up paying that out of pocket before they see any benefit. But in my estimation, healthcare should be affordable for everyone.
Mm-hmm.
And I'll make an analogy. If you used your auto insurance to pay for gas or to rotate your tires or to change your oil, those prices would be extremely inflated and it would almost be unaffordable to drive a car. But we do the exact same thing in healthcare, and it just drives up the prices.
I never thought about that analogy. That's a great analogy.
Yeah,
that's really a terrific analogy. So when we hear the discussion, people paying $5,000, $6,000, $7,000, $8,000 a year monthly, collectively for the entire year for their premiums, right?
Yep.
So some people are basically saying, you know what? I guess I'm just not going to pay $8,000 a year. I'm going to risk it, right? I'm going to try to save the money, but then the risk becomes if something goes wrong with you, now you get all the out-of-pocket expenses.
Yeah, so what I recommend is that you have a health insurance plan that you are comfortable with, and you can get a less expensive health insurance plan and use me for your health care. Mm-hmm. And that way you can save money because you're going to get the one-on-one attention. You'll get the 1-hour appointments. You'll know what the costs are, and you'll know that I'm looking out for your best interest in terms of your finances as well.
So we're going into a new year. I closed a couple minutes together. We're going into a new year. 2018 is right around the corner. Where do you see your business going next year, the next, let's say, 1 to 2 years? What's your, I know you said 500, you're going to cap at 500. Mm-hmm. Any other aspirations or things that you want to achieve over the next 12 to 18 months?
Yeah, so in the next 8 months, I'd like to hire a second doctor because we're growing and there's a lot of demand for this. And there's residents who are graduating who I'd love to have join my practice. And there are even some doctors in the community who are getting burned out and looking to join my practice. So that's priority number one. And priority number one also is providing excellent service for my existing members and making sure that I remain attentive to all of their needs.
As a city, are we healthy?
No, we're not healthy. And there's a lot of reasons for that.
Okay. And from your standpoint, close a minute together, so what are the top 2 or 3 issues that we have as a city when it comes to health?
I think access to excellent education services for everyone. And with education comes health. And like I said, 90% of what I do is teach people. I teach people how to be healthy. The other thing is having access to healthy foods and healthy places to exercise and be active.
So is that a function of just the city going through a transformation quickly in terms of we've been an automotive giant for so long? Is that the biggest reason you think?
Yeah, and I think there's a lot of roads that separate us, a lot of wide major thoroughfares that separate maybe our house from the park that we want to exercise in. And it's just difficult to get there because there's a barrier.
Yeah. Okay. What is the website? How can people get more information?
If they want to check us out, we're at Plum Health DPC.com, and that DPC is for direct primary care.
You have phone numbers where you want to share?
Yep, 313-444-5630, and that dials my cell phone. So if you want to get me, that's a great way to reach me.
Dr. Paul Thomas, we want to congratulate you for all the great things you're doing. We want to wish you much continued success in a wonderful holiday season.
Thank you so much, Mark, and to you and yours as well.
Thank you. There'll be more guests after this commercial break on Small Talk with Mark S. Lee.